And we use AI and healthcare claims data to be able to detect any billing errors, missed reimbursements, benefit payments, and benefit opportunities. And we turn that from insights into action and actually recover dollars both for the employer back into their budget and for employees back into their wallets.
And for employees with W-2s, you don't really understand the full costs of healthcare.
Yes.
You pay a very small fraction of what that healthcare actually costs your employer, and it's really not insignificant. I've worked for a lot of companies. They actually give you a benefit statement at the end of the year showing you exactly what they spent versus what you spent. And if you're a small business owner, you know exactly how much you spend. It's a small fortune. So what gave you the idea for this, and where did that come from?
I mean, you're probably referencing when you're talking about W-2, you're probably referencing our premiums that we are paying, pre-tax, probably some HSA dollars we're setting aside or FSA dollars we're setting aside, and those could be smaller. But the average household in this country is paying far more on healthcare once you count also the out of pocket expenses that they are paying, especially with the rise of high deductible health plans. Right? Deductibles are $3,000 right now before insurance kicks in. And so the dollar amount that a household is paying far outweighs the premiums that they are setting aside for that. At the same time, we're talking about employers that have been chasing this cost trend on healthcare, especially larger employers that self insure their employee population. They're practically the health insurance for their population. From an out of pocket expenses, think about it as I pay 20% and they pay 80%, right? And so they are on the hook for the majority of the out of pocket expenses that their employees and their family members are incurring and needing to pay the providers. And that trend has been on the rise. In the past 3 years, that cost trend has been above 8%. This is way above the inflation rate. And it is both creating a healthcare affordability crisis for both employees and employers. How far can you shift costs towards the employees and the households when they are dealing with massive dollars compared to their take home pay in terms of healthcare? Not just premiums, but out of pocket costs. And on the employer side, I mean, these are businesses. These are not health insurance companies. They are health insurance companies, but primarily they're businesses. And to have to manage the second largest cost on their P&L is a massive endeavor, especially when these costs are rising year over year, way over the growth rates and inflation rates.
Now, I can see your salespeople kind of walking into, either a CFO or an HR leader or maybe the CEO's office and telling them we can make your healthcare better, we can make your employees happier. What is it specifically that kind of makes them lean in and go, wait a minute, what?
Yes, look, it's a simple idea of reclaim. There are dollars in the system that should be going back to you, the employer, and to you, the employees, without having to change your plan, add more benefits, narrow the network of availability for the healthcare services and the provider choice for your employees. Um, and that can be resolved by just minimizing the wastes and the inefficiencies of your current benefits and the current plan. And you could do that without employee action, without changing behaviors. So we're not asking people to eat less, exercise more. These are owed dollars that are brought back to both you and the employee. And we're not doing this based on reports. We're not providing insights so that you and or your employees go after chasing these dollars. We're doing that completely on behalf of both the employees and the employer. And what it generates, really, it just generates actual dollars back. No ROI methodology, no hoops and, gigantic math formulas to come up with an ROI. There's actual dollars. It's 0 or 1. Did we recover the dollars? Did we not?